You're listening to Risk and Resolve, where leadership, business, and risk management collide. We bring you real conversations, sharp insights, and strategies for success. And now for your hosts, Ben Connor and Todd Hufford.
So for those of you that haven't met me, I'm Ricky Hancart. I'm a benefit advisor at Connor Insurance. And as a consultant, I live in problem world. We've heard a lot about problems in healthcare today. I like to joke that employers have 99 problems and healthcare is 87 of them, okay? So you sit in enough conference rooms, Zoom calls, and you realize that's not really a joke anymore. So what I want to talk about today is, healthcare is showing up as the most unpredictable and least controllable, frustrating line item on the balance sheet. We've heard a lot about that from, Northwind, talking about GLP-1s, we've talked about direct primary care, all of these things, right? And so this is a story that impacts all employers of all sizes. It's the same story. So we built a solution using key strategies and partnerships that are really foundational for building a more sustainable healthcare future. I'm excited to share some of those strategies and talk to some of our solution partners today on how we're trying to just help you guys as employers solve for those problems. But let's go back to the main problem that I hear from employers that we're working with. Employers tell me all the time that healthcare feels like a game of heads, the carrier wins, tails, they lose. And in this situation, really good year, your rates go up, bad year, your rates go up even higher, okay? So either way, you're really losing in this coin toss, right? It's the status quo story. It's the hamster on the wheel, right? Unpredictable premiums, claims volatility, spend that feels out of control, and decisions that are reactive instead of strategic. What I hear from employers is that they want protection, okay? They want protection from surprises. They want control over their strategy, and they want transparency so they can make decisions like a driver, not a passenger. Our team set out to build a safer path where a small and mid-sized employer can get the benefits that large employers have access to without a design that financially wrecks them. Our custom health plan is designed so that if you need to make changes, you can, without major disruption or surprises. The pieces can be removed, expanded, and even rearranged as needed, like building your very own Lego house. It's adaptable to your business and your employees. The status quo carrier plan leads you to pay and pray situations. Pay your premium and hope your renewal isn't too high. But we know that hope isn't a strategy. Our plan allows you to keep the upside when you have a good year. Invest those dollars, reinvest those dollars in your health plan and your employees or any other area of your business. Nobody wants to spend more on healthcare than they have to. So we have vetted and selected partners that solve real problems. We go direct to the source for the best experience while still integrating them into one health plan. But the point isn't a vendor list. The point is that our partners are cohesive and accountable to your strategy. Someone in here is probably saying, couldn't I just go to direct to all these employers and do the same thing? And it's our opinion that you could, but you probably wouldn't have the same outcome. So what we do, our goal, right, is to collaborate on the risks, collaborate on opportunities and emerging programs in the marketplace with creativity, and execute with courage. Not only with you as the employer, but also with our solution partners. We make the complex simple. That's our goal. This relationship operating rhythm is the cornerstone for us. But partnership Partnership is what makes sustainability possible, but partnership without execution is just a logo slide. So the purpose of today's panel is to showcase key partnerships and strategies that drive success for our custom health plan, but can be valuable for all employers of all sizes. For small and mid-sized employers, this is an access conversation, tools you don't typically get because of your size. For large employers, this is an execution conversation. Many of you could be doing these things, but aren't. I just really like Zootopia. I have a 4-year-old, guys. It's a great movie. So at the end of the day, we want to be creative and courageous in how we build and execute sustainable health plans. And the result is that you, employers, get to be the hero. So it is my pleasure to introduce you to Jeff Whitaker, the lead underwriter at TPAC Underwriters, Lindsay Wilson, account manager with TrueRx, a pharmacy benefit manager, and Jeff Williams, co-founder of Wellbridge Surgical, a bundled surgical center here in Indianapolis. To round out our conversation, I want to introduce you to Luke Snyder, the CFO at Process Alliance, a courageous employer who chose to go on this journey of building a sustainable health plan with us a couple of years ago. So like what Thompson said, we want to work with people that desire to change the healthcare landscape. I love that he mentioned that. And one of the things that I love about working with Luke and his team at Process Alliance is his desire to learn and ask questions. So to kick us off on this panel, I want to ask you, Luke, why did you desire to ask the questions about delivering healthcare differently?
Thanks, Ricky. Everyone hear me okay? Alrighty, so a little bit about Process Alliance. We started in 2018. 2026 is our 4th year offering any type of benefit to our employees. We specialize in engineering and science services in the consulting world to life sciences and big pharma, which I know might be a little taboo in this organization.
Nobody's got tomatoes.
We have employees located all across the United States, from Maine to Oregon, and everything from recent grads from college to long tenured, experienced individuals, all who potentially need a health benefit solution for them in their region or geography. Addressing Ricky's question, one of our culturally embedded values of Process Alliance is curiosity. And that forces us, we have an obligation to ask questions and not accept the status quo, and always trying to be a better model throughout the entire organization. And that applies directly to the benefits world as well. Our experience in this environment is not unlike a lot of other people's. We've had high claim years, we've had cancer diagnosis, we've had no visibility into plan claims data, and we also had a 50% premium increase for the 2025 plan year. And so that was our first year under this solution that Ricky's talked about, and it's been awesome for us so far. This is our 2nd year, no major changes, which was very nice enrollment. So if you're involved in that world, I know you can appreciate that. Another reason is we are a family-first professional services organization. So we are selling people's time. And so our most valuable asset is our people and the time they spend with Process Alliance. And so we use an analogy all the time about the 3 sides of a triangle. And we've got our employees, our PA employees, we've got our PA clients, and then we've got the company. And so if one of the 3 sides gets out of whack, it's not necessarily a triangle anymore. So it really applies to a lot of the decision making we do throughout the organization. And then lastly, I would say we feel like we have the responsibility to help influence better long-term health for our employees and their families.
That's great. You mentioned the 50% increase. So one of the things that we ended up doing is I got on the phone with Jeff at TPAC, and I said, I have this group with a 50% increase. We have a breast cancer in the claims data that we know of. And actually, this is kind of came out organically that we found out about this. We didn't have claims data. And so I got on the phone with Jeff and said, what are we going to do? This is the common theme. Like, what are we going to do? So I want to ask Jeff the next question, just to share with the audience really what an underwriter looks at when he gets a group like Process Alliance with a 50% increase, or even just a new prospect that's going through maybe a riskier, have some risk on the plan. Just give us some insight into the underwriting mind. I know everybody's going to be really excited about this.
First of all, I'm sorry. I'm an underwriter. Sorry. The one thing I always like to think about is the one thing we want most of all is wanting to change the status quo. So are you excited about changes to status quo? Then we can do a lot of magical things. If you don't want to change it, there's not much that I can do. It's like, well, your claims were X. I just have to charge a little bit more than X, and that's the way it is. But part of my job is to figure out why are the claims doing what the claims are doing. And I know what tools I have to help mitigate some of those risks, what's causing the claims to do what they're doing. For example, if we have a cancer claim, I know I can implement this type of a program. If we have a drug spend problem, I know we can implement this type of a program. If we have an overutilization problem, we can try to implement these type of a programs. And the one thing I also understand is if you have a person with a cancer situation, yes, there's programs that we can do, but those are hard conversations that people have to have with other people to say, okay, we might need to try to change the care that you're getting, not the type, but maybe where you're going. And so what I'll have to do is have a conversation with Ricky, and I'll say, okay, Ricky, here's the problem inside of this group. Is the group ready to make the change that they need to make, have the conversations that they need to have? And if they are, okay, now what can we do to the claims? And then that's how we can start lowering things. Because if you can turn a $500,000 claim into a $200,000 claim, I can do a large reduction in what I have to charge.
Simple, right?
Yeah.
Very, very simple. Along those lines, we used to mention cancer. Are there any other emerging risks that you look at that employers in the room should know in the next 12 months that they need to be paying attention to?
The biggest problem is cancer. And very specifically, cancer, it's J codes. And for those of you who don't know what a J code is a drug that has to be administered inside of a facility by a medical professional. These new cancer treatments that they have coming out are great. They're wonderful. They're doing a lot of wonderful things. They're helping people stay alive a lot longer. They have a better life. It used to be like 6 or 7 years ago, if you were diagnosed with a stage 3 or a stage 4 cancer, you probably only had a couple of years. Now you have 5 to 7 years at least, which is great. It's wonderful, except these drugs are not affordable by any stretch of the imagination. And to take one more notch of complexity on that, facilities have learned that they can upcharge these J codes significantly. And so the key is how do we get the steerage to the facilities that aren't upcharging things? And for an example of this, Keytruda is a drug I'm pretty sure most people have heard about. And Keytruda started out as a small cell lung cancer drug. It turns out it's a great drug. It helps with a lot of metastatic cancers. And what you can do is you can basically put that on any single person who has metastatic cancer, and it works great. The typical cost that you should be running into for Keytruda is about $250,000. Unfortunately, not everybody does that. There's one facility that's going to charge you $250,000, And I've seen other facilities charge $1 million for the exact same drug. So the key is how can you find a way to steer to the facilities that are going to treat your people, give them the drug that you want and they need, but also make it so it's an affordable price.
So great. I have a great example of that. Not Keytruda, but it's another medication. And I'll actually call back to, we talked about SAGE transparency. There's a medication, there's a J code called Perjeta, and it's for treating HER2 breast cancer. The average claimant goes through 17 cycles of this. We had on a group in this room, there's a claimant that was being charged $27,331 per cycle for the one medication. That entire claim ended up being about $50,000 per cycle, okay? I went on to the price transparency file and found that the cash price for that medication that they posted at this facility, this one facility, the cash price was $19,336 for that one injection, that one cycle. The Medicare price was equal to $12,784. There are solutions out there. There are providers, point solutions or solution providers that can actually get that medication. Either there's terms called brown bagging, white bagging. If you're in this industry, you probably heard this before, but it's just a way of getting that same medication at a different price and maybe putting it to a different site of care for infusion, maybe even bringing it to your home. And there is a solution out there that would charge $13,000 basically to come in their house and infuse that same medication. And one of those programs is actually something that TrueRx does. So I want to pivot to Lindsay to have her talk a little bit more about the TrueCodes program and how you found success, not only for the employer, because of course we're talking about lowering these really high cost drugs, but how this has impacted the employee population.
Yeah, absolutely. So TrueCodes is our J-code optimization program. So it's designed to help lower patient cost by moving those high-cost infusions that are traditionally billed under the medical plan over to the pharmacy plan, because we can control that spend of the medication. But I personally think that TrueCodes is a patient care program more than it is even a savings program sometimes. Our program is ran by a team of nurse navigators. So these are all former infusion nurses that understand how this process works, both for the patient, the provider, and now they're on our side helping us, fight for the things that those patients need. There are some exceptions to medications that we can work with. So our typical TrueCodes list are medications that have very predictable dosing and administration, something that we know ahead of time so that when we deliver a medication a day or two in advance of an infusion, we know that patient can still get that medication that day. Oncology drugs can be a challenge because those are, most of the time the dosing or the infusion is decided the day of. So it makes it harder for us to be able to supply those oncology drugs the day of. However, there have been situations where we have had our clients come to us asking for assistance. And if we can help, we will always find a way to make it work. We just have to make sure that those medications meet our criteria and that we can avoid additional risk for our clients by providing that medication through the TrueCodes plan. So as far as how it affects the patients and the clients, we have a really great story. We had a college student on a plan living in a dorm far away from home, and she was having to travel from her dorm room to an infusion center to get this medication, and we needed to move it from the medical plan to the pharmacy plan. Throughout this process, her infusion center that she was utilizing was not willing to take delivery of medication from an outside pharmacy. So we had to explore different options so that we could still get her the medication that she needed. And during the conversations that our nurse navigators had with her mom, they found out that this actually traveling to this infusion center for her while balancing her workload for school was getting increasingly difficult for her. and that if we could infuse in her dorm room, that would be fantastic. So our nurse navigators were able to coordinate with a home infusion partner to do her infusions directly in her dorm room. So at the time, the savings were modest to the employer, but the patient's experience was tremendously better from what she had been dealing with before. Since that time, she is now studying abroad. So obviously, you can't make a decision to study abroad if you are tied to an infusion center once a month or once every couple of months. So our team was able to work with her provider to transition her from an infusion to a self-injectable medication so that we could deliver her medication several months supply in advance so that she would have it with her. And then we coordinated additional deliveries to her parents who could take it to her while they were visiting. It allowed her to live the life she needed to live, but transferring that medication from an infusion to a self-injectable also saved her employer $4,700 a month. So this program can be hugely impactful for both the clients and the patients. Patient care is always at the forefront of what we do, but we're also working to save you money, minimize your risk anytime that we do these.
Yeah, that's wonderful. We have lots of stories. I mean, you just heard Thompson talk about how do we minimize the time people have to engage in the healthcare system, and just the idea of, I don't have to drive, I don't have to spend, for that person that has to get that cancer medication or that infusion for a different condition, they're spending 4 hours at that infusion center. That's 4 hours that they probably have to take FMLA or PTO. They have to have somebody to drive them there. They have to have somebody to drive them home. We're talking about, again, a situation where you as the employer can give your employees time back. And as a mom, as a friend, as a family member, I always want more time. I don't want to spend that time in an infusion center. So I love that Trex is participating in that. Along the same lines, I want to pivot. Jeff, I want to have you give the audience a little bit of an overview about Wellbridge Surgical, and really, what are the advantages for employers and employees for engaging in Wellbridge?
Sure. Good afternoon, everybody. If just to kind of get a poll, have you heard of Wellbridge? Kind of raise your hands and kind of get an idea. Okay, great. Probably half the room. That's better than 4 years ago, Ben. So yeah, Wellbridge Surgical is a outpatient surgery center here in Indianapolis. We're over off of 96 and Zionsville Road. So depending on which way you came today, you might have from the west side, you probably would have passed right by us. And so what is an ambulatory surgery center? I didn't know what that was 6 years ago. It's a outpatient surgery center, so which would mean you would go home the same day. Okay, so but that doesn't mean that it has to be a small surgery. I mean, cochlear implants can be done in an outpatient setting, total knee, total hips. So we're doing some pretty major surgeries at Wellbridge. And so that's really what we are. What do we stand on? Kind of the three-legged stool. I didn't come from medicine. From what you just heard me say, I came from a business that had increasing healthcare rates. And so from a patient experience standpoint, that was the first thing. And it didn't take a lot to get the patient experience better in that surgery center. So the other thing would be quality outcomes. So luckily, my business partner is a doctor, so that's good, right? He's an anesthesiologist, and he's the anesthesia. They're the quarterback of the OR. He knew that there could be better outcomes out of the OR than in the setting that he was in. And then the last piece would be a lot of us in here that are paying for health insurance would be transparent pricing. And so that's the three things that we stand on. So patient experience, pretty easy, right? When you walk in the door at Wellbridge, Stephanie has a smile on her face. And she probably already knows who you are because you've been working with her. And I see some head nods out there. You've been working with her through our app, Clara, through the entire experience. Quality outcomes, we're transparent on our pricing, which I'll talk about here next, but we're also transparent in our quality. So if you would like to see our quality scores, we post those quarterly, and we can show you those. We don't hide behind anything. I can talk about our surgeons at some point too, and then the last one would be the price and transparency. If you go to our website, you can see all of our pricing. It's an all-in bundled rate, so anything that's happening day of surgery at Wellbridge is in that bundle. There's a few like cochlear implant exceptions, and you'll see that on the website just because there's different implants, and we think it's very important for the surgeon and the patient to make that decision. And we just do the implant as a pass-through in that case. So all the prices are bundled on the website, so you actually know if someone came in for a total knee replacement today, and our price is $23,500, and you had another employee that came in December, our price is still going to be $23,500, which, if you're seeing your claim dumps, is not the case anywhere else. And then the other piece to that is that lo and behold, a random guy from another industry and business and a random anesthesiologist, we figured out how to lower healthcare rates by 50%. It's crazy, I know, but it's been 4 years now, and if it wasn't true by now, we would have figured it out. And so that's what Wellbridge is. Those are the three kind of values that we're standing behind. And yeah, 4 years later, we're still here. We're booming, and we're just really, really passionate about contracting, with self-funded plans and helping them to be able to lower their rates. We don't charge a PEPM either, so that's one of the questions that people normally ask, which means you're really only paying us if your employee needs surgery, and you're going to pay 50% less and have a great patient experience and a great quality outcome.
That's wonderful. What is the best way for an employer to engage with Wellbridge? Like you just mentioned there, you need to be self-funded, but how do you get people to go to Wellbridge? How would an employer do that?
Yeah, so we're in network with most of the big plans now with our price that's on the website. That didn't happen. It's a fairly large feat, but we held our ground, and that has happened now. So you could come to Wellbridge just by knowing about us, right? But for your employees that maybe don't know about us, what we talk about is zero tiering. And so I don't know if anybody knows the Surgery Center of Oklahoma, but they've been our mentors through this whole process. And they told us right out of the gate, the only thing that gets employees attention is cold hard cash. It's like, okay, that gets my attention too, so I'm listening. And so they said, if you waive the deductible and you make it free for the employee, and here's another key, if the deductible has been hit, that you offer a cash benefit, right? Then you will get employees to take a look at Wellbridge and come there. And so what we found out is Dr. Keith is correct, because after 4 years, we've had people try all different sorts of incentives, an extra day off of work, or a $250 gift card. I mean, we've seen it all. The only way to get your employees to pay attention to the Wellbridge incentive is to waive the deductible. We won't go into nerding out on how to make that happen today. That's for Connor Insurance to help you with. There's a lot of different ways to do that. That is the only way. I checked in with Dr. Inman just a little bit before this talk to make sure my stats were correct. But after 4 years, he's done the research. He's actually an accounting major at Purdue, and then took the MCATs and became a doctor. So we can all boo him next time you see him. He's a very, very intelligent individual. From his stats, he did a white papers on it too. That's on LinkedIn if you want to go out there. 800% better chance of your employee coming to Wellbridge if you zero tier versus you not zero tiering. And so after 4 years, we've got the data. We nerd out on data. And so this is how you get it done. Like I said, there's no PEPM. And so think about it. Let's just do rough numbers because I'm not as good with numbers as Dr. Inman is. Let's say you get a really good deal and get a $40,000 total knee versus ours, rough numbers, is $20,000, right? If you're paying the deductible, right, on that, and let's just say there's $3,000 left on the deductible, Can anybody do that math in the audience of what the ROI is? I think there's a CFO right here next to me. They can probably help us out on that too. It's a pretty good return on investment, and patient experience and quality outcomes are taken care of, so you don't need to worry about that, right? It's a no-brainer to do the 0 tier, and it's really the only way to get people to come consistently. We've seen it now, and we've got plenty of testimonials. We've got plenty of folks here in the audience as well. And then, so you say, well, we don't really have the staff, to really go out and make sure all of our employees know about this benefit, right? You can put it in the plan, but if nobody knows it's there, right, then you don't get any traction. Well, I'm sure you've talked to my account management team over here at our booth. If you haven't, swing by. Their job is to give you monthly content that you can push out to your employees, whether that is a video from Dr. Inman. We have a brand new virtual tour of our facility where Dr. Inman walks you through the facility, or just a PDF that's customized. We'll customize that PDF for you to talk about your specific plan. Every single month, we will give you content to be pushing out. We'll also come out on site. We've sat in a lot of your break rooms and talk to your people one-on-one, come out for open enrollment, even if it is at 5:30 or earlier in the morning. Maybe there's somebody out here that we went to open enrollment that early. But we're here to help educate your employees of this benefit. Last year, we put $5 million back in Hoosiers' pockets. If that doesn't get you excited, check your pulse. $5 million back in Hoosiers' pockets to spend the way they want to, instead of on a dysfunctional, healthcare system.
That's awesome. I think you're sensing a theme, $0 care. So when we are talking about transitioning some of these medications, specialty drugs, primary care, we are talking about the 0 tier lane. And really what that means is, finding these solutions that bring your costs down as the employer, but ultimately give free care to your employees. And that seems really complicated, but I promise we vetted these solution partners, and really what we've created with our custom health plan that I'll talk about in a minute here is putting this all together kind of with a nice little bow on top. And I know it's inside of it, it's not all easy, right? But it's really incredible work that we're getting to do together. So just to close out here, I do want to give one shout out to a partner that's not on here, and is the TPA. So for Process Alliance and a lot of our groups, Unified Group Services is also a TPA that has really, really done a great job in, again, putting this all together and making it simple for our employers. And they are, independent and can be nimble and put all of these together to make it easy for employees. So I really appreciate them being here and helping, Process Alliance and many of our customers. But I want to close up because we're coming up on time. I want to ask Luke, I want to close with you, and what advice would you give to employers in the room that want to get more involved in the healthcare supply chain, but are maybe still fearful? We've heard a lot of complex things sort of today, and you might be wondering, well, where do I start next, especially if you're in that small to mid-size space?
Thanks, Ricky. I would say, first off, is we are not experts in it. By what I mean, we as Process Alliance, I'm not, and our HR department is not experts in the benefits. So having Ricky and Stephanie and the rest of the Connor team is vital to listen to all of our questions, some of our harebrained ideas that we hear on a podcast or something, and then it's just really helpful for us to be able to bounce ideas off of them. So I would say that's step one. I think I mentioned that the transition to this new model has been overwhelmingly positive, but it's still scary. It's a big change. We didn't add any overhead staff to support this, so it's pretty low admin burden from our side. Great partners like UGS and TPAC, and TrueRx, like we mentioned earlier. So in a perfect world, consistency and stability on what people see every day, and the plans and the TPA and the network is very important. That's kind of one of our main drivers is consistency and stability when it comes to people trying to find care. And so my recommendation would be ask a ton of questions, be curious, listen to your employees, and really always try to move in the direction of better. That's one of our kind of internal things we say all the time. And then putting on my CFO hat for a little bit, I would say we all know the benefits expense is one of the top 5, maybe top 3 expensive lines on your P&L. And so it's worth the time and effort investment that we make to make sure that the benefit is actually a benefit to our employees and not just a check the box. And then adding on to that, a proactive approach for the cancers like we talked about earlier, and then your specialty med prescriptions. So we utilize Benefit Smart and a specialty med to help us manage those costs. That really helps us to not have massive 50% increases every year, hopefully. So we'll still see how that works in 2027. So, and then I would say the bottom line is to find a balance between having an educated healthcare consumers, so our employees, hopefully they're educated healthcare consumers, and then couple that with ease of use and access to care. We try to eliminate, or not eliminate, but reduce the number of hurdles people have to access the care. And so I would say that's the bottom line there. So.
That's wonderful. And I think that's the question, that's what I mentioned before, is this is an access conversation for those groups, but for your size group and, smaller, but even for the large employers in the room, we're talking about strategies that you could easily do. You just have to have the right partners. And so I'm really grateful for all of our panelists today. Each of you plays an important role in helping employers navigate this incredibly complex situation. So thank you for being on our panel today. Before we let you go for the day, I want you to just take a step back and think about everything you heard today on stage. We talked about primary care models with Nice Healthcare, contracting with a hospital, Northwind's clinical diabetes program, the way pharmacy and risk strategy work together, right? These are all components of what we internally call the Connor pathway. And if you're a customer of Connor right now, you have probably seen this framework. It's something we walk all of our large employers through as they move from a reactive health plan to a more intentional and sustainable strategy. As we talked about earlier, though, for many small and mid-sized employers, the challenge isn't understanding these ideas. It's access. It's access to the right partners, aligned incentives, access to a structure that makes these strategies executable. And that's really what led us to build DirectPath. So DirectPath is our custom health plan designed to bring the same principles in our Connor pathway, access to care, aligned partners, data-informed decisions, and financial stability into a structure that small and mid-sized employers can realistically implement. So instead of trying to assemble all of these pieces on your own, employers have a clear, direct plan forward with Connor Insurance. If you're interested in learning more about how this works, there's a QR code on the slide, and you can explore it further with us. More importantly, I hope today's conversation gave you a clearer view of what sustainable healthcare can actually look like when the right pieces are working together. Thank you all for coming.
Thanks for tuning in to Risk and Resolve. See you next time.